Good afternoon, I'm Carl Roberts and welcome to Tag Together, a group. Tag team, together everyone achieves more. Okay, we're going on to our first module for the next 5 or 6 minutes. What we're going to talk about is the Mental Health Continuum Model. What is that? I'll explain shortly. Just thinking back to the introduction with various modules and subjects that we're going to talk about, this is the first module. However, as anything, we've also got to keep ourselves reminding ourselves why we are here, and we've actually clicked on this YouTube video to watch it. It's about people. People matter, whether that be yourself or as a team. What's the aim of this team? We are hoping we're going to invest our time in you, inform you on how we can get better, and inspire you to take action. How are we going to do that? By giving you the awareness, the confidence, the knowledge and growth. So we can tune into our environment and we can support each other, and more importantly ourselves. Go look after yourself. Okay, some statistics. Did you know that half of mental health problems, they call it, I call it concerns, are developed by the age of 14? And they've established 3/4 of them by the age of 24. What does that say? We've got to look after ourselves as an individual and as a team. Okay, the Mental Health Continuum Model. What does it mean to you? Basically, I think when I look at it, it looks like 4 boxes. That's exactly what it is, and I'm going to explain and break it down. Okay, but as we look at the arrows left and right, and also at the bottom and the top, well-being, excellent levels at the top, and low-being level, well-being at the bottom. Okay, on the left-hand side, we'll see clinical diagnosis. What does that mean? Someone who is a trained professional that can identify signs and symptoms, and I'll speak about that shortly. And also, over on the right-hand side, no diagnosis. Okay, so we'll put ourselves in the environment that potentially we may have to go and see somebody professional, a doctor, for instance, someone who is a recognised professional that can talk to you. And things that they may encounter or you may encounter will be things like depression and anxiety. And again, don't worry about that too much at the moment. That will become more apparent, and we'll talk about that within the podcast and the YouTube clips. Okay, what would they do, and how would they potentially talk to you? They talk about your feelings, behaviours, your physical symptoms, and your actions. A professional is there to support you. Okay, so what are we trying to do? We're trying to improve and maintain our well-being, feeling positive, feeling good, enjoying life, enjoying being comfortable in ourselves and as a team. Okay, so you can see, my wrong hand, on the right hand side, you see on the top right, what we're trying to do, we're trying to remain here. Okay, we may go into any of these boxes at any time. Why is that? We ask ourselves. Nobody's perfect. There may be times when the situation, actions and environment, social circumstances, work pressure that may move us into anywhere within these boxes. Okay, we've got to try and maintain a person who experiences excellent levels of well-being and has no mental illness on the right-hand side. Again, team, there may be times when our mental health and well-being will fluctuate. I.e., what do I mean? Goes up and down. As I spoke about previously, depending on our circumstances, the environment that we may find ourselves in. Okay, I spoke about previously as well, within the well-being, remember, connect with people. It's good to talk, share and listen. Be physically active. Yeah, looking after our diet, conducting exercise, learn a new skill. It's great learning a new skill. Give to others. Okay, and when I say give to others, I'm not saying give them something materialistic, possibly your time. Okay, your time to talk, communicate and listen. Remember, 2 of these, two of these and one of them. Okay, and again, be tuned into your environment at the current time. Remember, in some cases, team, the storm will pass. We speak on the left-hand side within clinical diagnosis, a person who has excellent levels of mental well-being and diagnosed with a mental illness. Okay, it's nothing to be ashamed of. Okay, we can't diagnose ourselves, hence why we potentially need to seek further assistance. Okay, and again, in the bottom left, low mental health, low clinical diagnosis, a person who is being diagnosed with not being diagnosed with a mental health illness, and you also have a low level of mental health and well-being. Okay, we don't really want to, or we would try to avoid being in this area. Okay, and we ask ourselves, how and why would we find ourselves in this space? Okay, of thinking that something's wrong with us and not having a good state of mind. By not talking to you, by not talking and communicating and reaching out. Okay, so normal life activities. Okay, we should be in and around this area here. Well-being. Our well-being will fluctuate depending on the circumstances and the situations we find ourselves in. Keep motivated, keep going. Okay, if potentially you that is not working, okay, carry out your research, look online, seek, talk, share and listen with family members, with friends, anybody. No one should have to suffer in silence. It's okay not to be okay. Okay, a great group for support is the organisation called Mind. Okay, research that on the internet, and it's got top tips how you can support yourself and support each other. Remember, it's a safe space where we can talk, share and listen. Thank you for listening.